So, good morning, everyone. And my name is Ramesh Mahalingam. And, as they had introduced, I don't know a whole lot about healthcare. Let me start off. I know there are a lot of experts in the healthcare field. And I have been a technologist for the past 30 years, and I've been a researcher in artificial intelligence for the past 20-25 years, before AI has become a popularity. And I was very happy to listen to the previous speaker, Pradeep Kaur, and Tejasri's presentation, and extraordinary clarity in what they had presented, and very happy to also see how progressive our state has become. And I have now ஒரு 60 countries travel பண்ணியிருக்கேன். And I have to say, I'm very, very proud that our state is far progressive and far advanced, not necessarily in its technology capabilities, but also in understanding and being open to new ideas. And us being open is the foundation for advancement. So, with that, I've always thought, I always wondered why TamilNadu is advanced, is so progressive. Maybe the answer to that is our foundational Tirukkural of நோய் நாடி நோய் முதல் நாடி அது தணிக்கும் வாய் நாடி வாய்ப்புச் செயல். இந்த மாதிரி ஒரு ஃபண்டமெண்டல் ஃபவுண்டேஷன் மாடல் ஆர்டிஃபிஷியல் இன்டெலிஜென்ஸால் கூட கொடுக்க முடியாது. பிகாஸ் ஒரு ப்ராப்ளமோட நோய் நாடி நோய் முதல் நாடி அதோட ரூட் காஸை கண்டுபிடிச்சு வாய் நாடி வாய்ப்புச் செயல், then you actually figure out what the treatment should be. So maybe the reason we are so advanced is probably because we've had a much stronger foundation model from the likes of Thiruvalluvar. So with that, slideshow காட்டலாம். But what I would like to show is a sample of what we are doing in our AI-powered hospital. இப்போ AI powered hospital அப்படின்னா it is becoming it's a cliche, ஒரு gimmick. இது என்ன எல்லாரும் சொல்கிற ஒரு மார்க்கெட்டிங் டேர்மா இது? ஆர் there true value in artificial intelligence, and why should we do artificial intelligence powered hospital, and also why AI is unique in transforming healthcare? There are some fundamental questions, and I'm hoping in the next 20-25 minutes I'll be able to share at least my 2 cents. இதில் என்னோட credibility என்ன அப்படின்னா, as I had mentioned, I have about 30 years in this field, and I'm also I also have an investment firm. We've invested in about 14 different companies across the globe, mostly in the healthcare space, in epigenetic models and so on. So with that, I'll share why we wanted to create AI-powered hospital. We plan to have about 15 of these hospitals in the next 12 months. And the reason we wanted to create the AI-powered hospital is because no matter how much capabilities, how much technology is brought in, affordable care has become a problematic thing across the globe. You know, why is healthcare continuing to soar for patients? Why don't patients have affordable care? And this has been a haunting problem because I travel across Africa also, a lot of different countries, a lot of governments, many cabinet ministers across the globe ask the same question. Why is technology unable to bring the cost of healthcare down for the patients? This is where I think the answer lies within artificial intelligence. Is there any fundamental difference? I think there was a gentleman actually asked a really good question, and I would like to address that as well, if I can. But the fundamental value of AI is, for the first time, a technology is challenging the knowledge economy. அதாவது இதுவரைக்கும் கம்ப்யூட்டர் ரெவல்யூஷன் வந்தபோது நம்ம வந்து கம்ப்யூட்டிங் கெப்பாசிட்டியை தான் சேலஞ்ச் பண்ணினோம். அதே மாதிரி மொபைல் டிரான்ஸ்ஃபர்மேஷன் வந்தபோது கம்யூனிகேஷன் மீடியமை சேலஞ்ச் பண்ணினோம். But artificial intelligence, for the first time, it is challenging the knowledge economy. And இதுவரைக்கும் நம்ம பண்ணியிருக்கிற டெக்னாலஜி ஓட total market பார்த்தோம்னா, it is only about $3 trillion. It's $3 trillion in the last 45 years. But in the next 3 years, artificial intelligence will become a $28 trillion market. So அப்படின்னா, every aspect of our day-to-day life will be driven and powered by artificial intelligence. Whether we like it or not, this is going to be the case. So, why AI in healthcare? Why AI-powered hospital? There is a very fundamental reason. You see, healthcare has been...
Sir?
Yes.
Sorry to interrupt, sir.
Sure.
All delegates, please be seated. It is a very informative session. Please. Sir, thank you, sir.
Sure. Yes, actually, I hope this will be very informative, and please, I do request, spend a little bit of time in paying attention to it. See, artificial intelligence in healthcare uniquely is going to be transformative because of all the contributions of all the healthcare experts and specialists and doctors such as yourself. Because it is one of the most well-documented domain in the world. So, whether it is a disease, whether it is a treatment, whether it is a symptom, எந்த ஒரு விஷயமா இருந்தாலும், for the last 70 years, the doctors, the surgeons, the peer review journalists, everybody have actually done a phenomenal job of codifying it. எல்லாத்தையும் கோட் பண்ணி கரெக்டாக ஆர்கனைஸ் பண்ணி டாக்குமெண்ட் பண்ணதுனால artificial intelligence is uniquely placed to transform the healthcare industry. So, the other industry that it has transformed is the programming industry. Same thing, the technology field has been well codified, so we have already been transformed. But this is very important. I wanted to actually stress the fact that artificial intelligence transformation in AI, artificial intelligence transformation is very, very critical for the healthcare industry. So with that, I want to show you a demo. I want to show a sample of how we are utilizing artificial intelligence to assist our nurses, to assist our doctors, to assist the surgeons, and how it is also playing an important role in training and providing continuous skills and training development for the healthcare practitioners. So, I wanted to show one example of how and why we are an AI, we are trying to turn this into a fully AI-powered hospital. So with that, I'm going to quickly show, because I know the screen, the slideshow can be a little boring, but I want to make sure we have something that is a little bit more interactive. So I'm going to switch to a quick demo, and I'm going to show you some of the power of AI. So this is very, very important. This is not to showcase anything else. This is for us to actually understand what the future of healthcare might look like. So with that, let me quickly switch to a quick demo, and I'm going to ask a few questions and see how artificial intelligence is handling it. Now, at any given time, again, towards the end, any question, please feel free to ask. So this is one piece of segment within our hospital. So in the Mari, we have similar segments within our hospital, where, as I had mentioned, nurses, doctors, surgeons, they all interact with the AI system, and then AI actually provides the proper guidance. A very important thing is that the AI engine adapts to the audience themselves. So, for instance, ஒரு nurse interact பண்றாங்க அப்படின்னா, the AI model has the ability to adapt to the persona of the nurse, and it will actually have the ability to communicate with them in that model. So, if you really think about skills training, for instance, the skills training problem, there is a fundamental shortage of skills, and then there is a fundamental shortage of knowledge. How much can nurses ask a question? How much insight they can get? How deep can the insights be? How much guidance they can get? So there is a significant problem in the shortage of skills when it comes to training competent nurses and junior doctors who are coming into the field. So what we had done is we have created simulated cases for many of the patients, and then we allow the staff to actually ask questions and gain more insight by interacting with the patients. So let's first, I'm going to show you a sample example of how it's going to function, and let's see. Hi, are you available?
Yes, I'm here. How can I assist you with Maya's care right now?
Can you explain Maya's heart rate, please?
Maya's blood sugar level is currently elevated. Her fasting blood sugar was recorded. Her fasting blood glucose is. Maya's blood sugar is 1.
Do you see any concern with her elevations?
Sure. Based on Maya's blood glucose levels, she's showing hyperglycemia. Her fasting blood sugar is elevated at 142 milligrams deciliter.
அவங்களோட glucose level என்ன இருக்கு?
Her blood glucose level is
தமிழ்ல
slightly
சொல்லுங்க.
elevated, which is common post-operative.
Can you say it in Tamil?
Her blood glucose of 162 milligrams deciliter is above the normal fasting.
Hello, are you
range.
listening?
Overall, her blood glucose level.
Maya Deviyoட blood glucose level எவ்வளவு இருக்கு?
Maya's oxygen saturation is currently 90%, which is a bit low. We want to aim for at least 94% or higher. We could consider adjusting her oxygen therapy.
So,
कुल मिलाकर ये संकेत में अभी उनका स्पोटू 90% है, जो थोड़ा कम है. हमें ऑक्सीजन सपोर्ट बढ़ाने या पुनर्मूल्यांकन करने.
No, that's good. Hold on. Can you pause? Can you explain the piperacillin tazobactam?
अभी उनका ब्लड ग्लूकोज लेवल 1.
Hello?
Hello, how can I assist you? Sure.
Can you explain piperacillin tazobactam?
Piperacillin tazobactam is a broad-spectrum antibiotic. Sure. Piperacillin tazobactam.
Sorry, the problem in there is a significant noise in the environment. So every time there is a noise, that is, and the echo varudhanala, it keeps going into a loop. So bear with me on that in this noise level. It's significant noise here, but let's continue to do it. Yeah, can you explain the piperacillin tazobactam, please?
Piperacillin tazobactam is a combination antibiotic. Piperacillin is a penicillin-type antibiotic that works by killing bacteria, and tazobactam is a beta-lactamase inhibitor.
Can you pause?
Piperacillin tazobactam is a broad-spectrum.
So what we end up actually doing here is when we ask a question, it is not just a question of just responding to the question. You can actually gain lot more insight from the AI system as you are conversing. In fact, even with the noise level, it is actually quite impressive because generally number situation it has to be in a closed environment where the doctors are actually interacting. It is not on such a massive decibel level right now what we have. But even with that, it is significantly impressive. So so how do you interpret the GCS level for Maya Devi?
It looks like the Glasgow Coma Scale GCS wasn't recorded properly in the system. Could you share the page? Got it. The Glasgow Coma Scale isn't recorded properly right now. Could you confirm the patient's eye, verbal, and motor responses for a more accurate GCS score?
And what's her temperature level?
Sure. Right now, Maya's oxygen saturation is at 90%, which is on the lower side. We should monitor her breathing closely.
And what's her temperature?
Sure, take your time. I'll check back in a moment to see if you're ready to continue.
Yeah, I kind of expected because of the significant noise level. More and more it's listening to somebody else's noise, it is actually responding back. Oh, 5 minutes left. So the important thing to note is that we are utilizing this assistant for nurses. We are using it in the doctor stations. We are using it in the surgeon stations. So essentially, the artificial assistant across the entire hospital is being utilized. And we expect to have this as the core baseline. One of the questions that I wanted to address to the gentleman's request is that, is artificial intelligence going to be the decision maker within the hospital? And that is never going to be true. Hospital setup la, artificial intelligence is going to be merely a companion. It is about assisting them to know if there are any alerts, any significant elevation, any challenges that it sees. To one of the important questions that was asked is, who is accountable? It's one of the important questions gentleman actually asked. It's a very important question and it has to be addressed. No matter what happens, AI will continue to be just a tool. Now, if we allow the tool to run without an oversight, the accountability still lies with the people. So you can never take humans out of the loop, but what it does is it relieves significant stress and the burden of the healthcare workers. So this would be a very important companion. And so there is, I know I'm quickly running out of time, but if you want to actually see a demo on a quieter environment, I'll be happy to do so. But the AI-powered hospital, the vision of the AI-powered hospital is that from pharmacy pharmacy prescription to the diagnostics lab to our ICU monitoring as well as the surgical process. We have actually enabled this AI assistance across the board. The power of having artificial intelligence here is that it will continue to adapt to the persona, and because of that, the healthcare team can be trained, they can be continued to be upskilled. So, this is an experiment. Certainly, idha modal vaati try pandrom. What will the experiment really result? We don't know. But we expect to have about 12 of such hospitals that will be fully powered by artificial intelligence. And probably by the end of January, we'll have clear results as to how the AI-powered hospitals will fare. So far in the first hospital, it has done extremely well. And most importantly, we have been able to reduce the cost of health per patient so far by about 18%. So about 18% of cost, we have handed it back to the patients because we were able to optimize it through the AI models. So we hope to actually reach about 30 to 32% in the next 6 months. So across 18 hospitals, if AI as a companion is able to reduce the cost of healthcare by 22%, we think our goal would be accomplished. So we will know in the next 3 to 4 months. So I think I have run out of time, but I'm happy to field any questions that you may have regarding the AI or any challenges with respect to AI.